All right. Well, good morning, everybody, or good afternoon, depending on where you are. We're very excited to have everyone here today. We are going to have a really very powerful webinar from Ahmad Bennett called Living with Chronic Pain as a Healthcare Provider. Wanted to note some details on the slides as everybody's getting logged in and start with introductions. So my name is Christina Clayton. I'm one of the co-directors of the Northwest MHTTC, Northwest Mental Health Technology Transfer Centers, our longer name. We're very happy you're here. We want to first start with our land acknowledgement. We are asking for people to consider the lands on which we live and to think about the unceded lands and traditional territories of Indigenous peoples who have been here since time immemorial. We just want to take this time to acknowledge this land and always work for justice in those communities. So even though this is a virtual space, it's very important to us. We have 272 tribes that are federally recognized in our Region 10, which is where we mostly operate. It's not on this slide, I apologize, but we also are now doing a labor acknowledgement and want to really acknowledge that the University of Washington, as well as many institutions, has been founded on stolen and unjust labor practices, and that we really want to acknowledge that as well. And we know that people today are still living with those kind of conditions, and there's a legacy of slavery in our country. But so we just want to be thinking about that as well as our land acknowledgement. All right, now we're going to start with the introduction to our network. So we are a nationwide network that is supported by the Substance Abuse and Mental Health Services Administration, otherwise known as SAMHSA. And our network is changing, actually. So we will hopefully get an updated slide, but we are part of a network that has 10 regional centers and a network coordinating office. And the two yellow boxes, the National Hispanic and Latino MHTTC and National American Indian Alaska Native MHTTCs, are actually turning into centers of excellence through SAMHSA. So after the end of this month, that will be transitioning. But at the time being, we have a lot of information through all of these centers, and all the information is free. You can get to all of their information on the website. A little bit more about us. We are in Region 10, and we are at the University of Washington in the Department of Psychiatry and Behavioral Sciences. And our area of focus for the network is evidence-based practices for psychosis. But as you can tell by today's topic, it's not the only thing we talk about. We have excellent faculty expertise and other projects that relate to CBTP and assertive community treatment, but we cover a lot of ground. And our main goals are really to support best practices and EVPs and heighten your knowledge and skills and foster community and alliances, and most importantly, free training in TA. And so we do that through live and recorded webinars like today, virtual learning communities, online courses. We have newsletters and training announcements, a resource library, and a podcast. And so in a few weeks, you'll see a podcast that Ahmad and I just finished recording. So always really great to talk to people for a short bit. We also want to acknowledge that we know language is really powerful, and we want to always be thinking about recovery-oriented language. These are our values, and we know sometimes things can tick off something in us, and you're able to chat with everybody. So we're just hoping that everybody here's going to have that respectful language. It's just something that we as a network agreed to share at all of our events because we just want that to be top of mind. For today, you are muted and you're off camera because it's a webinar and there are quite a number of people here. It is being recorded and there is closed captioning available, and it will be shared by video later, and the slides will be available. There's a certificate of attendance if you would like that. So there's an option to do that. There are no formal CEUs. And then today, for logistical purposes, if you have tech questions or just a comment or something, please share that in the chat. But if you have content questions for Ahmad, please put those in the Q&A, and I will be queuing those up as we go along. And we will get to that, I believe, probably near the end. So at some point, I'll come back on camera if we have 40 questions and we're running out of time. But otherwise, I think we should have enough time to get to all of that. All right. lastly, we are really, supported by SAMHSA, and we are, they have a disclaimer. Obviously, they fund us. They don't know all the details of today's presentation, but really importantly is we really value your input. And so really want to make sure it just takes a couple of minutes to fill out this survey. There's a really strange personal code it asks you for. Put in any numbers and letters you want because it doesn't matter. And that's actually straight from SAMHSA because they're taking that off soon. So if it seems weird and personal, it is. So just put whatever numbers and letters you can, because what's really important is your feedback. And so it just takes a minute or two to fill out, but we really look at your input, see if this is content you like and want to see more of, or if it was horrible, we also want to look at that too. And we share this all in aggregate, with our team. So we don't know who said. All right. Now to the important part. Ahmad, if you were here with us last year, Ahmad did a wonderful webinar on, I think I'm going to space on what was it called, Ahmad?
Intersectionality of the veteran community.
Of the transitioning veteran. I was going to say intersectionality. No, I know. It was a great title. But I am so pleased. And Gabriel Orsi, I just want to give a shout out. She's our program manager, and she's in the background making sure all this stuff is happening. And so I know you all knew each other from prior employment experience and worked together. So I'm very glad that we have you here again today. So I can read your bio. If you just want to share about yourself, what would you prefer?
I'll just yeah, go ahead.
Okay. So Ahmad is a licensed marriage and family therapist, associate, and certified mental health professional in Washington State. Ahmad completed his internship with Valley City's Behavioral Health. After graduating, he began working with Seattle Counseling Services until their closure, which is definitely very sad here in Seattle. He then entered private practice and founded Crossroads Family Therapy in 2022. He graduated from Antioch University at Seattle with his Master's of Arts in Marriage and Family Therapy, and he focuses on providing individual, couple, and family therapy for communities of color, first responders, and veterans. Ahmad is also an adjunct instructor at Antioch University, Seattle, and teaches a sexuality and healthy relationships course. Ahmad is a medically retired Navy veteran and has worked in veteran-focused social services for over a decade, including working at Lake Washington Institute of Technology for 5 years as a veteran coordinator. And Ahmad specialized in housing insecurity, employment services, and veteran transition services. So couldn't be more grateful to have you here, Ahmad.
Thank you.
Very, very glad to see you. And we'll take it away.
All right, I'm gonna go ahead and share my screen.
Thank you.
A second. Make sure everyone can see that okay? Everyone's got that okay. All right. So if you see any cats in the background, I apologize. They're my daughter's cats, and they were adamant in coming in here. So hopefully you won't see any whiskers in this presentation. Good morning and good afternoon. My name is Ahmad Bennett, just as Christina introduced me. And today we're going to talk about living with chronic pain as a healthcare provider. I found some interesting information about this subject because it happened to me, and we're going to get into it. So some of the questions I want us to ask ourselves is, as a chronic provider, nurse, doctor, therapist, psychotherapist, what happens when we can't show up? And I'm not talking like we get COVID and we're sick for a couple of weeks, or we have like an incident where we break our leg or something along those lines. I'm talking about the kind of chronic pain that takes a while to figure out and takes a while to diagnose and to rectify. We still have to keep showing up. That was my experience. I'll be honest with you. When I originally started working and collaborating with this organization, I was going to start doing something around EDI as a therapist of color. How can we show up for different communities, veteran, non-veteran? So I was kind of working on that until something happened. I woke up one morning and I couldn't move. I couldn't get out of bed. And that one incident in January lasted for 3 months, where we found out I had severe diverticulitis. I'm going to have a surgery next week to remove 10 inches of my colon. And I was diagnosed with bladder cancer, and I had a tumor removed. I'm only 46. I didn't know what I didn't know. Of course, I always understood from an academic perspective of what chronic pain can do for certain communities, especially with opioids and the drug addictions that we're currently facing in all of our communities, how that got started with a lot of overprescriptions of opioids is one way that got started. I can understand it, but I couldn't empathize with it because I never had it happen to me. This is kind of some of my lessons learned from my experiences for providers. What happens when we can't show up? And fun fact, I like to throw in some facts and figures. Nobody's studying this, which I find very interesting. Nobody's talking to doctors and nurses and psychotherapists, et cetera. When they have chronic pain, how do they show up? I found one quasi study that mentions like, hey, we're people too. And that was just about it. So let's take a look at it. Topics of discussion. And so I'm going to be looking to my right. I have a separate screen off camera. So if you see me looking over there, that's what's happening. Working while unhealthy. It impacts the care. Does it make sense to take a break while navigating illness? What does your self-care look like for your physical and mental health? Who's in your corner? Have you identified who's the team members that are going to be showing up for you? Let's talk about professional boundaries. Work and live or live and work. Does it make sense? Setting patient expectations. So with the caseload and clients that you carry, how do we manage that? How do we set organizational expectations? And how do we approach those if we don't have anything written already? And then financial expectations. I'm in private practice. I don't get PTO anymore. I miss that. So how do you keep paying your bills and showing up financially as you're trying to figure out your medical situation if you can't go back to work? Let's get into it. So when I talk about chronic pain, we're talking about something that lasts for at least a year or longer, either through the experience of the pain, the actual diagnosis, the treatment plan, and med management, etc. We're talking about something that reduces your ability to show up for yourself in every capacity, from taking care of your physical self, cleaning, going to the bathroom, etc., to doing the things that you normally do that we take for granted, like going to the grocery store, or putting gas in the gas tank. You can't even do that either. This is what we're talking about when we talk about chronic pain. So the current thinking is a lot of physicians. So when I was doing my research for some of this, therapists weren't mentioned, unfortunately. So we have to look at our doctors and our general practitioners. So physicians may not think that self-care is a priority. When we come into this space and the work that we do, we want to show up for communities that typically have not being served correctly or not being seen. So when we get into this work, we want to show up for our own reasons that we get into this work. We want to show up for those that are less than, or whatever that purpose is. We want to serve and just try to create a space for growth and safety in our communities. And that's why I'm assuming that's why we became social workers and therapists. It's because we wanted to contribute to that. Part of that work and going through grad school is we got to do the thing. We got to do the thing. We got to show up. We got to be present. That may give us a sense of invincibility, a sense that we can't take time off. I'm just making some assumptions because, again, there's no data here. Sometimes we often delay getting help. I know when I started feeling things, I just pretended, I just got gas or something. I'm sure I'm all right. Do we often ignore the signals from our bodies? Are we connected to our bodies enough to listen to what's happening to ourselves? We all get that sense like, I should probably get that checked out. But do you follow up on it? Concerned about being wrong in their self-diagnosis or may not want to bother colleagues. When I was going through this experience, for the first 3 months, I didn't know what I didn't know. I just knew that I hurt. It would be easier if I had like a cast on so you could see that, oh my goodness, Ahmad, something's happened to you. I didn't know. All I could tell people is that it hurt really bad, and that's as much information as I could give. I did not want to burden anyone else with that information because that's all I could answer. I didn't want to make anybody worry about me. I didn't also want to put my needs above others. And that's something that I had to work on. We're going to get into about the psychology of chronic pain and how that can remove our abilities to sometimes show up for ourselves. I minimized my symptoms. I probably felt pain for at least a week and a half to 2 weeks before I actually did anything about it. Why did I do that? Everything else seemed more important than me. Do we have that kind of sense in your job, in your office, in your space, in your personal life? We put priority on other things other than ourselves. I had to work through that. I felt selfish for wanting to take care of myself. Where does that thinking come from? Am I alone in that? Is anybody else thinking like that? I want to throw that question out there. Has anyone else ever felt like you did not have the ability to do the thing for yourself because you didn't want to be judged, you didn't want to be ostracized? Maybe you and your supervisor kind of have a little, and I don't need anything else to add to our relationship to make it challenging. Self-medicating, changing medications or dosage on their own. Well, at the beginning, that wasn't my particular issue. I just, I didn't know what I didn't know. I just knew that the antibiotics and the pain meds weren't working. So I was trying to get creative. Yes, I used a little cannabis, trying to, maybe that'll help pain relief. Not really. It was more than that in the earlier stages. And Gabrielle, if there's any time anybody pops in questions, I can't see any of that, please, I can slow down or what have you and answer questions.
Fantastic. Thank you for that offer. I'm not seeing anything that's a question. I'm seeing a lot of responses in the chat, people echoing that your experience matches their experience, and sending love and gratitude.
Thank you all. Appreciate that. I was anxious about the outcome of the illness that I was having. In the very beginning, like I said, I thought I was just having some stomach problems. I didn't really understand what was happening. Fear is a powerful thing. It's a 4-letter word for a reason. Fear is a powerful tool. My anxiety was through the roof. There's not enough citalopram in the world to take care of what I was feeling internally. I was thinking of every negative experience, every worst case possibility. Google was not my friend. Oh boy, WebMD. It's great for some things, but man, not when you don't have all the information, and then you get more information without context can be dangerous. And the wheels just kept spinning and spinning and spinning. Like, what is going on? What is going on? The professionals that I'm leaning on are like, we don't know what's going on. We got to run more tests. That doesn't make me comfortable. But I understand there's a process. I wasn't in the know on the process, right? I felt anger, frustration. The first time in my life that I finally spent more money that I got to pay back for financial aid, went through grad school, sacrificed, did all the things to get to this place in my life where I finally feel like I can serve with autonomy, with my self-identity. I don't have to pretend to be someone I'm not. I can be me. I don't have a boss to answer to, except for I'm in clinical supervision, but that's, not really my boss. This is clinical supervision. I do my own thing. And there's pros and cons to that. But when you don't have all the answers, I was angry. I was so mad at the world that I can't do the thing. The injustice. Again, that kind of falls back to why me, right? It's like the stages of grief here, right? Denial, anger, all the things. I was going through it. I was grieving a loss of my identity, right? So I'm grieving the loss of my identity. The identity, somehow, some way in my mind, I still think I'm 22, 23, but you tell my knees sound like a box of Rice Krispie treats, man. Snap, crackle, and pop. My back is not my friend sometimes. As the older I get, I'm having to realize I'm not 22, bruh. You can't do the thing. No, you can't shoot hoops with them youngins. You need to sit down. I'm at that stage in my life now, and I'm having some conversations with my own identity and ego. So how can I be having cancer in my 40s? Are you serious? It didn't make sense. We just got through COVID. 2 years of COVID. I'm holding it down. Finally get out and breathe some fresh air. I got cancer. I was mad. The guilt. This was the thing that really kept me up at night. I have some amazing clients. Amazing clients. Not being able to show up to these individuals who entrusted me with their biggest fears, their vulnerabilities, and their challenges. And the one thing that I wanted to demonstrate for the people I work with is consistency. I will be here for you. We will know our schedule. We will set our expectations. We will have our treatment plan goals. We'll consistently be working towards something. That only works if I'm in the room. So what happens when I can't be in the room? The worst thing I had to do was when it was so bad that I had to call out and cancel all my appointments for the day and had to beat feet to get to the ER. I was in tears. Because a lot of clients I work with are struggling. They're at that precipice of homelessness. The economy hasn't been easy. COVID, well, just look around. Y'all know. I don't have to go into it. Y'all probably feel that too. The last couple of years have been interesting with all the political turmoil. We got UFOs. I mean, just stop. It's too much. Too much happening in the world right now. The one thing I wanted to do was be consistent with the clients I work with. They know that I can be a dependable person. I felt like I lied to them. I felt like I lied. I let them down. We'll get into it. How do we manage that? We'll talk about that. The inflexibility of the work schedule. Again, I schedule it like I'm assuming most of you do. If you have a caseload where you're meeting with patients or clients, y'all schedule out a couple weeks in advance, right? The morning of, I get up, or that middle of the night, I'm canceling. Our job, unfortunately, we don't have a lot of support in that area when we're meeting people and talking to people in person or telemental health. We have to be here. It's not like I'm working on spreadsheets and doing financial analysis, and I can do that anywhere and it doesn't touch anyone. This is not our profession. We're on the front lines of showing up for the ones that haven't been seen. We're on the front lines for those who fall through the cracks, for those who just don't look the way that they should to be accepted or live a certain kind of lifestyle to be accepted. We're showing up for those folks. And so when we can't show up by no fault of our own, it's hard to carry that and keep showing up and being present. So this is the current thinking. And fun fact, if anyone can find some research on this, please let me know. I Googled, I went through the academic peer review stuff. I'm looking, I was like, someone has to be talking about this. There has to be some protocol for us. Doesn't exist. At least if someone can find and prove me wrong, I'll buy a Coke. So let's get into the meats and potatoes of this situation. What happens specifically? CDC says about 50 million adults live in chronic pain daily. I'm pretty sure that's a low number. When you start, and I'm wondering, is long COVID going to be considered a chronic illness? I don't know. That's a good question. At least 50 million people a day are getting up, not being able to do the basic things. So what happens? There's an increase in psychosocial stress. So what I mean by psychosocial stress, you got to talk to your boss and say, hey, I'm going to be out another week. Or, hey, I don't know what's going on, but I need to take these 3 days off to go do the thing. Can you have that conversation with your supervisor or leadership team without a fear of any kind of blowback or reprisal or any kind of passive aggressiveness? I'm in private practice, so I don't care. The only people I had to answer to was my clients. So for me, that psychosocial stress was just involved with my caseload. And I'm going to talk about how I manage that further on. Reduce quality of life. I live in Spokane Valley, Washington, which is a beautiful place. I really love Eastern Washington. It's great. I came out here for just to have a slower pace of life. I have 5 amazing daughters. We're doing all the things. We're riding bikes. We're going camping. We're going to Silverwood, which is like up here in the Pacific Northwest. That's a very fun amusement park, theme park. I can't do any of it. all this hard work and sacrifice to get through grad school so I could have the lifestyle that I want to live. Can't do it. I can't get out of bed. Financial stress. Ooh, my wife's an accountant. She let me know about the gaps in our finances once I started getting sick. So here I'm in bed like, oh. So we're going to have to cut back on this, that, and the third, and blah, 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 and this, that, and the other. And I'm just like, oh. One extra thing. Now, the only saving grace is all my issues and all my medical care has been covered by the Veterans Administration. Because, fun fact, when you get exposed to forever cancer chemicals, these things happen. So the VA has been picking up the tab for all of my medical expenses, but not everyone has that option. Estimated, my wife and I sat down just in the last several months with hospital visits, 3 months of hospital stays combined, the care, the medications, all the things, in excess of $300,000. If you don't have that kind of financial resource, well, we can talk about the healthcare. You know about the healthcare system and how that works. So, where does that money come from when you're not working and not making that money? Or your PTO, you're burning through your PTO, your paid time off. Financial stress is a thing. Impacts and strain on relationships. I have younger kids. I got littles. The owners of said cats that are hopefully not tearing things apart over behind my back. They're having nightmares because they seen their dad in a state where he couldn't walk and he was moaning and he was crying, which I don't mind crying. I cry at Super Bowl commercials. That's not a thing. But it's different when it's pain behind it, right? And so trying to manage that, trying to manage my kids and let them know, hey, dad's okay. Dad is not okay. His dad doesn't know what's going on. But for them, hey, dad's going to be okay. My partner, she has a full-time career. We split domestic duties inside the house and outside the house. We share equally as we can, and we cover for each other. You know, sometimes she has to take some work stuff and I'll take care of everything, or vice versa. My partner was handling dinner, all the stuff, the laundry, mountain laundry, we call it in our house, because we have a mountain of laundry that apparently just does not want to go away. My laundry should start paying rent because it's here all the time. She had to take care of all the things to run and manage a household. So any of you knows what goes into managing a household, try doing that hurt. Or if you don't have a partner, you got to do everything on your own and you're hurt. That's a tough load. Compassion fatigue. I knew I worked one day where I said, you know, I think I'm gonna be okay. Throughout the day, I progressively got worse because I'm thinking in my mind's eye, oh, I got a little pain. I'm gonna be okay. Everything's gonna be cool. I'm sitting at a desk, I'm talking. It's not like I'm digging dishes, or I used to be a cable guy. I'm not climbing telephone poles and, you know, doing all that I'm not doing physical labor. I'm sitting here talking, listening, engaging, right? I can handle it. When you have that aching, gnawing pain, it removed my focus. It removed my ability to stay connected and stay locked in and keep building that rapport with my client. In the back of my mind, oh my God, it hurt. And then when I hear my client talking about something, I'm like, really? That's what's going on? In my mind's eye, if I wasn't in pain, I wouldn't be thinking that. But now I'm like, tell me about your inability to set healthy boundaries again. That's where I was doing. I was like, I'm not an effective therapist. I can't do that. That's unethical. I cannot do that. I will never come to work feeling that kind of pain again because it removes my ability to stay present. If I can't stay present, then what the heck am I doing? If I'm thinking about all these other things and I'm not staying present with the person in front of me and really, really getting into what's going on for them, I don't think I'm an effective therapist. So, feeling pain, I need to stay home. Impacts to my own mental health. Whew. My therapist, Dr. Christina Wilson in Atlanta, Georgia. Amazing person. Had to help me just like, what are you doing? Like, you can't show up. The only person you should be showing up for is yourself right now. and making sure that you're doing what you need to do for you. So if you don't have a therapist and you're a therapist, I'm not going to be, come on now. If you're a social worker, you don't have a therapist, come on now. We have to have a place for this stuff to go in a clinical setting that we can talk to other people. We can't keep all this stuff inside. And that's just on any day that ends in Y. That's a normal day. But when we start talking about the chronic pain, loss, what have you, as clinicians, as professionals, we have to make sure we're doing our own therapeutic work, and we have to continue to do that. I did it because ethically, I'm like, yeah, that's what I should be doing. I really leaned on my therapist and unpacking my shame for not being present for my clients. They understood that very well and helped me work through what was happening for me, so I could get to a place where I can enjoy some self-care. So I do have some numbers for you. Chronic pain, excuse me, according to the government, chronic pain costs organizations up to $635 billion with a B dollars a year for medical costs and productivity loss. We lose up to $635 billion a year. Not like money is the main reason, but I'm just trying to frame this of everything that is not happening because of chronic pain. So productivity loss and medical costs. And so this is back in 2010. So I shouldn't say post-COVID world we're living in. So this COVID space that we're still navigating, I would love to see what that number is now. So this is the question I want to throw out to the audience. Just for like a minute or two. I would love to hear why you think taking a break while navigating chronic illness. Why should you do it? I would love to hear your personal thoughts on why you think it's good to show up for yourself. And Gabrielle, I'm hoping you can help me with that.
So we would love to see what you have to say in the chat. And if you want to raise your hand or chat us and indicate that you want to speak, that is an option too. It might take us a minute to unmute you. I'm seeing that people are already beginning to respond in the chat. Stephanie says you can't help others if you can't help yourself. Karen says you can't heal if you keep pushing. Mary also chimes in with healing. And now the responses are coming in fast. So take a moment to review that before I say more.
Hold on, where can I see? I don't see the.
So in the chat box, we've got a lot of people talking now.
My second screen, that's why. Duh. Come on, Mom, get rid of it. There it is. Now I got it. Oh, wow. I like what Nora's talking about. Pivoting. Can't perform your job properly. Yes. Karina, you're right. You can't perform your job properly with chronic pain. Quentin, to learn coping skills and prevent burnout. Facts. To learn about your illness, pain, and treatment. Double facts. To leave space in your bandwidth. That's my word. You owe me 25 cents, Quentin. To leave space in your bandwidth for basic functioning. Yes, we have to have space to do the basic things. Oh, Christina, stop getting ahead of me. I want to say that a little later. What else do we have? And Melissa, you're right. Taking a break is a luxury despite what's being is best. Some of us, and let's be real, I think I have the privilege to take advantage of self-care and take breaks, but there's a lot of folks out there that can't do that. They may have 2-3 jobs. Financially, this is not an option, or maybe their own personal lives that may be complicated. So self-care can take forms in many different ways. It doesn't have to be meditation and yoga and just walking. Yeah, with balances, sometimes this is my self-care. I'm playing Starfield right now. Baldur's Gate 3. I love video games. I'm a gamer. A lot of my clients, you can tell my iconography, I watch movies. And so that's a gateway to therapy for me, is images, iconography. So yeah, I indulge. I'm watching Ahsoka right now. Whoever said K, Mass Effect. I'm with you on that. The training is one of the few things with myself. Yes, yes. Okay, Melissa. So we have to get in where we fit in. Oh yeah, and I also run a D&D group too, every week. So this is what we have to do. We have to find ways to show up for ourselves. We have to do it. Melody, I can't talk about the Hawks right now. It's too soon. It's too soon. Well, let's see what happens. I gotta keep it down. All right, man. Maybe Gabrielle, we should just do therapy in Dungeons and Dragons, because that seems to be a topic that people can get behind. I'm seeing a lot of comments there. Oh yeah, Laura. Well, cool. I'm hoping. So this is kind of what we have to do. Is find ways that we can show up, and I call it balling on a budget. Right? We may not have the financial means to do all these different things. We may not have money to take trips and all the kind of stuff when gas is $5 a gallon. So we have to find ways to take our breaks. Yes, hot tubs are thumbs up on that. We have to find ways to take care of ourselves, and it could be at the lowest common denominator. So I'm seeing a lot of great comments in here. Think about ways that you can take care of yourself on a budget that doesn't require a lot of things, or maybe even money. Maybe it's just the activities and groups we're hanging out in. That's what we need, because when we are able to have self-care and take care of ourselves, it gives us capacity, or more bandwidth, Quentin, to show up for others and to be present. So I think everybody's picking up when I'm laying down, especially Laura and Kay with this hot tub business. Facts, all facts. All right, great responses. So I think everybody's attuned to what we're talking about here, because self-care is healthcare. I don't care what anybody say. Self-care is healthcare. If you're not taking care of yourself, you're not doing yourself a service. You're not doing your clients and your patients a service if we're not showing up and taking care of all of us. I kind of look at therapy sometimes, or just even being that person in my social group, or sometimes people plug into me for energy, for whatever they need. And I'm okay with that, as long as I have healthy boundaries, and as long as I'm recharging that battery, that professional battery. Many colleagues will sit down and we'll commiserate on, like, oh my goodness, how do we do this, that, and the third? Yeah, how do we do that? How do we make that work? We have to be able to recharge ourselves so we can continue to keep showing up and being present. So self-care equals healthcare, allows us to be present. So, not answering emails from home. I don't have work emails or work stuff on any of my devices except for the device that I work on. Because if I don't, so there was a time I used to work in corporate America as a project manager, and I had the work stuff on my phone. And every time that thing would vibrate, I would go, I could be eating dinner, I could be at a movie, I could be spending some time with my partner. That thing would vibrate, and my hand starts instinctively reaching for it. It pulled me out of whatever was going on. It removed me from the moment. So if you can, unless you have one of those roles where you're like in a crisis role, or you're doing like crisis support or something along those lines, if you can take your work stuff off your personal devices or have a healthy boundary around your work devices, do so. When I'm done working, I shut this bad boy down. We're done. And it's not because I don't care about my clients. It's like I need an ability to do what I need to do for me. So yeah, this is my workspace and my, as you can tell, probably my play space. So I have to be able to have that clear separation for myself. Regularly participating in hobbies and spending time with friends. Like I said, I do an online, I participate in an online D&D group, and I run my own in-person D&D group. And for those of you who don't know, Dungeons and Dragons is a role-playing game where you get to pretend you're be someone else. There's rules and blah, 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 blah. I do tabletop gaming. I love hiking. I love fishing. I love just sitting on a just by a riverbank, you know, in the Spokane River, and just putting a line in. My kids, I'm gonna brag a little bit. I'm gonna brag. My daughter, she's on the track team. She just led her as a freshman. So going to my daughter's track games, I used to be a track athlete in high school. I was an athlete, all around athlete in high school. Seeing my daughter just shatter her own personal records and do things that she never thought she could do is one of my best things to observe. So Friday nights, I'm going to varsity. Well, not tonight because we got an open house tonight, but I go to football games, high school football games. These are the things that I do. Participate in relaxing activities, mindfulness. I'm going to say it again, mindfulness, yoga. Keeping ourselves present is the theme of this exercise. There we go. Receiving supervision or speaking with colleagues about professional challenges. This is real. In this kind of work that we do, there's a lot of things that we have to manage legally, ethically, that aligns with our individual professions. There's a lot of things we have to manage. And I would love to sit here and tell you that I turn to my case notes every time on time. I would love to sit here and tell you that I track all the little things that I need to do. Sometimes I'm good, sometimes I need some help. So checking in with your supervisors, better said, having a relationship with your supervisors that allows you to be present, but not reveal too much, because, you know, every organization is different, every relationship is different. But having the ability to talk about what's happening for you and commiserating, 9 times out of 10, someone else is probably dealing with the same thing. That lowers the stress. That's self-care. Scheduling short breaks throughout the day. If I got significant gaps throughout the day, I'm taking a nap. 20 minutes, 30 minutes, nothing crazy. It's just I got to get a little bit of rest. My mind's always going. Sometimes I'll go for a little walk around the neighborhood in the middle of the day. So just being able to pivot and do some things for yourself is really helpful. Saying no. I struggled with this one. I am the epitome of people pleasing for my own reasons. Saying I would say yes till it hurt, because I did not want to let anyone down. I thought if I say no, that I'm breaking a relationship. And that's my own trauma work that I'm still working through. Sometimes saying no is necessary. Sometimes when people approach us with things or activities or projects or what have you, they may or may not know what's on your plate. They may not know your capacity in this moment, but you do. And if you don't, then that's a problem. You have to be able to settle in with yourself. Do that checks and balance. Yeah, I can do the thing. Or no, I can't. When you got chronic pain, now's not the time to be taking on some extra projects at work. Maintaining an exercise routine, that could take the form of whatever works for you. Just move. Your body has to move. We're designed to move. Homo sapiens have been designed to move. Sitting here, I don't move. For at least anywhere from 8 to 10 hours a day, I can stand. I have a standing desk behind me. I can stand, but we have to move. And so move whatever your body will allow you to do. We have to move. Not overloading your caseload with too many clients. Looking at you, community mental health. I kid. Be mindful of our caseloads. We can't do all things because, you know, we have to have time for assessments. We have to have time for our case notes, writing support letters, all the things that have to go into managing our caseload, making sure we're standing firm to HIPAA, right? We have to make sure that we're doing all the things. So don't overload yourself. I'm going to go back to a couple squares. Say no. When I was in community mental health, I think I was pushing, as an intern, about 20 clients. That was more than enough for me. And they tried to give me some more because, we were losing a lot of stuff happening. But I had to say no. I wanted to do more, but I'm an intern and I still have a full-time job, not in therapy. So what's the benefit to the client? That's always how I think about this question. Am I able to serve to my fullest capacity? Chronic pain? No. Go off. I think that horse is not moving anymore. But yes, seeing your own therapist, right? Who's in your corner? So we're talking about in your personal life. Who is in your corner? Again, we all got into this social work or therapeutic work for our own reasons. Never once as a kid growing up did I say, man, when I grow up, I want to be a therapist, were the words that never came out of my mouth. However, through experience, life, trauma, because trauma is the equal opportunity employer, I was able to kind of figure out, man, there's some things that I need to work on. I want to show up for folks that have similar experiences, and maybe I can help because I went through it too. When we have that mindset, which is, I think, admirable and honorable, we kind of think we are a superhero. At least I did. I feel like I'm coming into someone else's life and helping them solve whatever problem they want to solve for themselves. I thought that was awesome. I had to be at work every day. The workload was considerable. I found myself not taking as much time off that I need to. I found myself ignoring those things in the morning where I'm like, man, maybe I should just have a mental health day today. We are not invincible, despite what we tell ourselves. Despite what our ego tries to let us know, we are not invincible. Our clients may think we're invincible, but we're not. We're human beings, flesh and blood. We're fallible. We can make mistakes, and we're not perfect. And when you start getting hurt or you're living with chronic pain, we may have a sense where I'm going to fight through it and push through it, and this is how I'm going to do it. Who are you serving? Your client or yourself in that space, in that moment? Start asking yourself now, who's in your personal support network? We all have a lot of people in your support network, but who are the people that you know you can count on? Who's going to bring you the chicken soup? Who's going to help you go to the bathroom? Who's going to help you walk your dogs while you're laid up in the hospital? Who's going to water your plants? Who's going to take your kids to school? Maybe that's your partner. Maybe that's a family member. Could be even a colleague. Start identifying who's in those support networks now before something happens. Let's figure that out. And let's make sure we're maintaining those personal relationships. Make sure we're showing up for them too. It has to be equitable. May not be 50-50, but we have to make sure we got to be checking in on them too. So we can build that relationship of checking in on each other. I love Facebook, but I think it's removed our ability of checking in because now we can see people. Oh, yeah, they're doing that. Oh, they're so awesome. Yay. Oh, look at that. Oh. I'm old school. I'll pick up the phone. Hey, what's up? And have that conversation because there's so much stuff that comes out of that conversation that's not posted on Facebook or social media. So make sure we're checking in with the people that have value for you and and value the other way for them as well. Do you understand your treatment plan? If you're dealing with chronic pain and you're trying to find out that ultimate diagnosis, that can take a while, depending on the medical staff, the resources available. Have you tried to set up a new appointment with the doctor lately and you got a 6-month wait list? Seems to be the norm now. So you want to make sure that when you get that treatment plan, you have a copy of it, right? So do you have access to your electronic healthcare records? I put everything on all that stuff right here on my little terabyte thumbstick here. I have a folder just for medical junk. So I can keep track of what's going on because so many things get said to you in that medical speak, and I'm not, that's not my language. And I hear one thing that one doctor says, and they're thinking this way, but then it changes because they consulted with another doctor and oh no, we're changing this around. So make sure you understand your diagnosis, make sure you understand your treatment plan and how you need to take care of yourself when you're not in the hospital. You have a power of attorney, emergency directive, or an active will. Yeah, I don't. I'm gonna be honest with you. That kind of talk used to scare me. Not anymore. If anything happens to me, what happens to my kids? I don't promote this company, but do you have Aflac? Do you have some tools to help you with this space? Right? I'm not, again, disclaimer, I'm not promoting Aflac. I'm just saying, do you have those tools and things, criteria set up when you're not in pain, where you can concentrate and be present with this paperwork versus you're trying to fill something in your hospital bed real quick and something get missed? I saw it happen with my family that passed on. They didn't have a will. Don't put your family in that position, squabbling over whatever. Make sure you have that stuff ready to go. None of us are getting out here alive. I can say that 100% certainty. None of us are getting out of this place alive. So make sure you have that ready to go. Then who's your, again, I think that horse now has resurrected itself. We got to put him down again. Who is your therapist? So remember you're talking about that whole that psychosocial organization stuff, like, you know, having to take time off, having to write that request to take time off, or you just have to call out, and this is your 5th time this week calling out. How did y'all feel when you have to call out? What happens to you when you have to make that phone call or that email or what have you, right? For me, it was with my clients. Those are the only people I answer to. So I ain't gonna lie. For me to build trust, I was completely transparent with every single one of my clients. I blind carbon copied all of them with a statement basically saying, I have cancer. I'm going through some things and my attendance is going to be sporadic. No, it's not. And I remember in grad school, they're saying, look, never have your client trying to care for you as a therapist. I get it. We have to have that professional boundary. I understand. We don't want to be having drinks with our clients. You know, we have to be mindful of dual relationships. That's not what I'm talking about. One of the things that my professors told me, Dr. Anthony Bennett at Antioch University of Seattle told me, your clients are going to know when you're lying. How can I ask my client to be transparent, vulnerable, so we can do the work that we need to do, if I'm not demonstrating it myself? I got to walk the walk. So yes, I told my clients, I got cancer. I don't know what that means. I know my attendance is going to be sporadic. So I had to set an expectation that it's going to be hit and miss with me. I had to be vulnerable. I'm going to tell you, as a Black man who grew up in Baltimore, that is not my super strength. I don't do vulnerability well. I had to be vulnerable. I had to be accessible. So people needed to, I say, hey, if you want to, I just let them know, if you want me to refer you out to another client, or excuse me, another therapist, I get it. I understand. Just let me know and we can connect you to a different therapist who can continue your therapeutic work. My whole caseload responded back, we'll wait for you to get better. I'm trying not to get emotional here. I'm a new therapist. So my confidence in myself is, I'm getting stronger in it. But I really thought I was going to lose my entire caseload because I was gone for like 3 weeks in one sitting. Continuity of care is really important to me. To have all my clients come back and say, take care of you, we'll be waiting for you when you get back, is a testament to the rapport we built. We got to be honest. In this world in 2023, we can't fake the funk anymore, y'all. We have to show up and be honest. Now, that doesn't mean you have to talk about your personal life and the argument you get in with your partner, with your client. No, I'm not saying that. What I'm saying is we can't lie. And if we're in supervisory roles, we can't ignore. When you see someone not performing or not being themselves, you can't lie. We have to show up in all capacities, as a colleague and as a supervisor. We have to be honest what's going on with us. The only person I had to kick out of the room was my ego. So building trust with your client in my humble opinion, honesty, transparency, setting expectations. I personally teach that all relationships can benefit from three things: healthy boundaries, shared expectations, and direct communication. That's what I did. I'm asking my clients to do that. What kind of hypocrite would I be if I'm not doing that? Obviously, ethically, provide your clients with alternative care options. Let them know I'm not the only person here that can help you. I'm always client first. Who's in your personal and professional support network? I had to lean on some of my professors, my personal mentors, to help me figure out how I navigate this. How do I pivot from some of this? And lastly, just demonstrating practice what you preach. That's the pros. The cons: inconsistency of care, especially I work with a lot of adolescents. And so, showing up every session and doing the work that we're doing, I think it's important to me, it's important to them. But you know what happens if you keep missing a couple sessions, it's like the hit and miss. It's really hard to kind of get that rhythm and get that synchronicity going, right? So we have to acknowledge that's going to happen. Sometimes you being away or all of a sudden not being available could be triggering or activating for some clients. So just be mindful of that. Scheduling challenges. Once I was able to get back in the office, people's schedules, I was gone for a period of time, trying to get everybody back scheduled. It was a lot of double booking. So just trying to manage that was fun. And then the potential loss of a client, which I didn't have, but it could happen. So just going through that space. I'm going to check on some of these questions real quick because this thing's blowing up over here. Just going through. Okay. Laura says they always thought they were Wonder Woman. Yeah, I always thought I was Batman or Luke Skywalker, either one. Yeah. Okay. Let's keep it pushing. All right. So, organizational expectations to minimize that psychosocial stress. What is my relationship with my organization? We good? I've had a lot of different jobs. Some of them, I'm not going to throw shade. Some of them I was like, woo. By the power of Grayskull, if I got to go in this office one more time today, it's going to be on. It's like, how are our relationships at work? I've seen some toxic stuff. I'm sure we all have in some capacities. We may have had some toxic leaders. Where are we at in this organization, right? Sometimes this can feel like high school paychecks sometimes. So who can I talk to? Who can I be transparent with? Who can I be vulnerable with in this place? That can be hard. How do we set healthy boundaries with work? Again, I'm in private practice. So the only boundaries I have to set are for myself and the clients. But if you're working for an organization where you have an HR policy on absences, right? And it's like really hard too, because everyone's asking, well, what's going on? I don't know. Because the diagnosis for chronic illness can take a minute, right? Well, we're going to need some documentation from your doctor. Your doctor's going to say they sick. We don't know what's going on. Doctor so-and-so. Depending on the relationship with the supervisor, I've seen it where some supervisors are very supportive, and I've seen some supervisors use that as an ability to get you out of there. Office politics is real. So where are we at in that? Are you acknowledging that? Is there an issue? If there is there a way to resolve it? Or do we need to leave? I don't know. A lot of organizations I've left because I'm just like, I am too grown for this. So let's be mindful. Do you understand your state federal medical leave act, FMLA? I didn't, because I never thought I was going to be in this situation. And so when I started reading all that government paperwork, and I got to submit the this and the that, and I got to have my flex capacitor and blah, 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 and this and that, I was like, and I'm in pain. You ever try to fill out government forms when you're hurting? I don't recommend it. And you got to be accurate with this information or your file can get kicked back. So I had to fill out FMLA, Family Medical Leave Act paperwork, because I'm in private practice, because I'm having significant loss of income.
It's 11 o'clock.
Thank you, computer. I appreciate your assistance. I have that set, so when I'm with clients and we get into it, I have like a little reminder there, like, hey, shut up. You got to go to the next one. Not to them, to me, of course. So do you understand what that means? Do you understand the processes? Do you know who in HR is the keeper of that knowledge? If not, maybe we should know who handles someone with an HR, typically, or an administrative role, is responsible. They have to. Every organization has to have that. So find out who that person is. If you foresee that there could be something coming on down the road, talk to them now. It's like, hey, I got this procedure coming up, or I'm afraid I have a diagnosis of whatever, I have flux capacitor disease or whatever's going on. Make sure that we have that dialogue before we get sick, because it's really hard to play phone tag and email tag when you're in pain. Open communication is key, only if you feel safe doing it. Again, I say that with a caveat. Not all organizations are created equal. So being open, being clear, being concise, definitely be open what's going on for you. Make sure you're talking to HR, making sure you're talking with your leadership team, making sure you're talking with your colleagues, because there may have to be coverage of roles. Somebody might have to step in and fill the gap when you're not there in the office, and that can cause some tension. So have that dialogue before things start coming out. And yes, acknowledge that there are pros and cons of provider self-disclosure in this space. So let's be mindful of how that can show up for you and how that can be impactful for you. Again, financial expectations. Do you understand your organization's requirements? I mean, the last time you probably looked at this when you got hired, right? How often do we go back and check that stuff out? Do you have access and copies of your electronic healthcare record? Can you send messages to your providers? Simply and easy. Do you have the phone numbers? Do you have the things? Keep that documentation handy, because when you file for FMLA, that's what you need to submit. That's what I found out. So make sure you have access and copies of that. You don't want to not have it, and then when you need it, you got to go find it and you're sick. Do you already have a state and federal profile made already? A lot of states now, it's all done online. So go ahead and create that stuff. If you foresee that this is going to be something for your future, then this is what you want to do. Who is your HR representative? Who are they? Do you know who they are? Are you talking to them? How do you approach that? Check out here. Okay, understanding the FML. Yes. Kerr Sigmund, I hope I'm pronouncing that correctly. They say, understanding FMLA was a challenge, and it's very difficult to get any layman's explanation because HR would only send the formally written policy, would not sit down and actually talk me through it. Not to mention the amount of chasing doctors. Yes. Thank you, Kerr, for bringing that up. You have to have your doctor or your primary care physician sign off on all this stuff. And you're right. When I had to go get this information, there was nobody to talk to. And it was like reading legalese. So if this isn't your normal language and you need someone to help translate, let's do that now before you get hurt. Yes. Yeah, Amber, facts. It was a challenge. She says, they say, excuse me, I don't know, they say that the WA PFML website is awful. Yeah, it wasn't easy. Yeah, I've seen that happen. And Kay, you're right. In retail, that's how they get rid of people. In certain other industries and places, they use that to fire people who take FMLA. It happens. It happens. So, I mean, there's pros and cons to this, and I'm sure there's a lot of stories there. But yeah, that's a thing too. So we're at the end. I didn't expect to go through that. Well, yeah, that's for about an hour. I want to open it up to questions. I want to hear thought. Does anyone else have some ideas? Because this is the thing, y'all. There's no standard operating procedures for us as clinicians to do this thing, right? Like, I would love to just open up, say, step 1, go do this. Step 2, go do this. Step 3, call this person. So I would love for us in our organizations, the next time you go to your team meetings, next time you sit down, can you bring this up? Can you bring something like this up? Hey, can we come up with a process when someone gets sick or we have chronic pain as providers? What is the preferred method of doing this? How do we want to show up for this? Because it's going to happen. We have to have these dialogues within our groups and organizations. And then as clinicians and as therapists, we have to have the courage to tell the truth to the people we're working with. And it sounds counterintuitive because, we're supposed to have this, again, we're supposed to have this, professional boundary. I'm Ahmad, I have my master's degree, I've done the things. I play video games and I'm hurting right now. That's my self-care. This is what we have to do. There's no research. So maybe when I become a PhD candidate, maybe this will be my research topic. I claimed it. I licked it. It's mine. Don't nobody take that. So this is what I'm going to do. Because there's nothing for us. There is nothing for us out there on this. We talk about how we show up for clients. We talk about how we show up in all these other areas. And fun fact, and some of y'all could probably tell me better than this, nurses and people in these spaces, doctors, they're leaving for a lot of different reasons. They're completely overwhelmed. So how do we show up for ourselves as professionals? We have to set a standard for ourselves, especially in this COVID world, especially when I just heard the stat, there are more people under the age of 50 getting cancer worldwide than any other time in history. Something's happening. I don't know what. So, in conclusion, if we're going to show up for our clients, if we're going to ask them to do all the things, if we're going to ask them to be vulnerable, face hard truths, then we're going to have to do it ourselves, especially when we feel our most vulnerable and weakest. That's my story, and I'm sticking to it. I'm Ahmad Bennett, and I want to thank you for your time. So if anyone has some other questions, I'm listening. Gabrielle?
All right, Ahmad, we do have a question. Thank you so much for that. Yeah, I think, are scheduled till 12. So we have plenty of time for conversations. If people want to raise their hand, we can unmute folks. That's really nice. And if people want to put questions into the Q&A, often when it's riveting like this, people are busy listening and writing in the chat. So if you've had any questions that struck you along the way, please feel free. Melody, I see you. I want to get this one question that Laura asked pretty early on. So Laura asks, I'm a social worker and also a peer, and I run an online chronic pain support group. Can you talk more about peer support services and what you know about it?
Yes. Great question, Laura. So when I initially got into this field, I was a veteran peer support specialist. So I worked at a college campus when I was getting my undergrad, and I was a peer support specialist for other veterans coming into the community. So any kind of peer support group that you're a member of or a part of, number one, I think you've already established some sort of autonomy and community and connection, right? That's kind of how it goes down. So to bring these spaces out, when you're having these conversations, if we can have people be open, talk about their experiences, pass around ideas, because there's a lot of knowledge in these peer support groups. A lot of folks that from different professions, different backgrounds, can bring a wealth of knowledge to that space. Tap those resources. Encourage those folks to speak up. Encourage those folks to even construct a process that may work for them, that they could share out. If it goes out or not, that's this whole separate conversation. But at least let's sit in a room and talk about if we can create a standard procedure in this peer support group with all the shared experiences, what would that look like? That's what I would recommend. I hope I answered your question. But yeah, as a peer support specialist, when I didn't have any of the credentialing or pedigree, only thing I brought to the table was my personal experience in this particular subject. And for me, it was veterans. So chronic pain support group, those individuals can probably teach a class on what it's like living with chronic pain. Let's empower them to do so. Hopefully that answers your question.
No, and thanks, Ahmad. I mean, I think all of us who've gone through things and then suddenly you meet someone, even through friends of friends or somebody that's going through that same thing, you just feel this instant bond. At least that's my experience. And you really can't fake that, you
Mhm.
know? And so I think as we go through more things, we have different experiences, and hopefully we are able to connect with other people. So I'm really glad you're doing that, and appreciate the insights there. Okay, so sorry, I'm gonna try and get this. Melody. We're gonna allow you to. Oh no, your hand went down. Did you not want to speak anymore?
Oh, she's back.
No, she's there. Okay, hold on. Hold on. I just did it wrong. Allow to talk. Melody, you can unmute, and I think you can speak now.
Hey, Melody, you there? I'm not hearing anything yet. Just giving a second for Melody to be able to come in here. Would you cats stop?
Melody, we can come back sometimes. It's like a microphone setting or something. We're not hearing you right now, but we'll just mute you for now and then come back. I don't know what I did. Suddenly you're on the panelist side. So, we learn new things every time we do these. So I'll go back to some of the Q&A and just raise your hand again, Melody, when you're ready. Okay, Rachel asks, are there any specific mindfulness practices you suggest for chronic pain?
Well, that's a great question too. Depending on what we're dealing with, for me, I just started really doing transcendental. I can never say that word. Transcendental mindfulness meditation. I'm saying that wrong. I just started learning how to do that. That worked for me. Of just quieting my mind down. I've never been able to do any kind of mindfulness or meditation until now in my life. I think I just had a tough time sitting still. So that was a practice that I like to use, where I was able to connect with my body. I am now understanding the relationship between wherever the mind goes, the body will follow, right? So I'm just starting to understand and respect that relationship. So trying to have a healthy output is going to increase the healing, give you better opportunities to heal faster if you have a better outlook. If you're negative and, in a negative place, that may take longer. So trying to have a positive mindset, you can tell this is pretty much how I am in session. I'm that guy. I don't care. I'm just going to be present, respectful always, but I'm going to be present. And I'm just going to be me, because I don't know how to be anything else. I've been faking the funk in so many different careers, trying to be these other people so I can at least do the job. Just going to be present. So for me, the transcendental mindfulness worked for me. Stress balls work for me. So it all depends what kind of chronic pain that you have. If you have some physical things where you can't do any mobility issues and stuff like that, just be mindful of whatever you're navigating, and test out everything. See what works.
Great, thank you. Oh, Melody, I think you're back. I think you're unmuted. Do you want to speak? I think you're allowed to speak. But we can't hear you. So sorry. Melody, if you could put your info in the Q&A just so we can at least get to it. Oh wait, there she is.
Hey,
Oh, I don't know your title. I shouldn't say that. Sorry.
Can you hear me?
Yes, I can hear you.
Oh, yay. Yay. Hi, Ahmad. Hi, Christina. My
Pleasure.
pronouns are she, her.
Thank you.
I'm here in Spokane, Washington, too. Recovering from COVID. And I'm also the chair for Prevent Suicide Spokane Coalition.
Yes, thank
Perhaps, Ahmad, you'd like to join us sometime.
you. Yeah.
But your comment about, and I put a little bit something in the chat, is about being true about how you feel. I've been doing that for about a year. and just letting people know that, hey, I'm not having a good day right now. My back is killing me, and or hey, I'm having a lot of pain today. Or I even said, I even started seeing a psychiatrist in March, and now I'm telling everybody I'm seeing a psychiatrist, which is, I don't know why I waited so long. Best thing ever. But even though I am so true with myself, it doesn't seem like people are ready to hear it all the time.
Yeah, that's
You know?
that's a true statement. A lot of people, for different reasons, aren't always ready to hear your truth, and that's okay.
Yeah.
They may not understand it, but they sure as have to respect it, right?
Right.
As long as we're being transparent as you are,
Yeah.
kind, and honest, it
Yeah.
is what it is, right?
Yeah.
And so I'm not going to apologize because I got sciatica.
Mm-hmm.
My back hurt. I can't be present today. And that's the tough thing. That's when I was when I was saying, like, if I'm not wearing a cast, or you got some sort of thing on you to say, hey, I'm hurt.
Yeah.
People just they're not present, and that's kind
Yeah.
of
I'll say something like, "Oh, I'm just a little off today," because I'm not here. I'm hurting.
yeah.
And it sometimes it does allow me to have excuses, but other times, like you said, people just like kind of look at you like, that's too much information.
And I look, I'm here being. I'd rather you just know what's going on, and not fill in with your own information, right?
Right.
Oh, this is too much. I don't want to. Look, it's going to affect you. If I'm not
Right.
here, you might have to pick up the slack in my workday. So
Yeah.
instead of talking trash about me behind my back, oh, here's mine. He's always on the office. I've seen that movie.
I'm just saying, as a chair for
Mhm.
Prevent Suicides Coalition, that's the one person who should be honest about how she's feeling,
Yes. Yes.
as far as mental health goes, or any other thing. Be true to
It,
yourself is so important.
considering the subject matter that you're dealing with, you need to be present, right?
Right.
You have to be present. And if we're not present, I'm not saying things could happen, but I don't want to have that on my conscience if I miss a key element in someone's story or a situation because I wasn't present.
Right.
I don't want that on my conscience. So I'd rather just have context. And I'm not here.
Yeah.
So,
Anyway,
thank
perhaps
you.
I'll see you at one of our meetings, Ahmad.
You got me. You got me. I'm in Spokane Valley. I can go up to the V. Are you at the vet center up here off of Pine, or where y'all at?
No, we're through our ESD 101 is our fiscal agent.
Okay.
And we cover all of Spokane. And yes, we have the VA and the Air Force Base involved. And
Oh, yeah. Fairchild. Yeah.
and along with all the mental health professionals. In fact, Ahmad, on August 29th, we're having, I would say me, but one of our organizations is having our first behavioral health fair in Spokane.
Hit me up. We'll
Okay.
connect. We'll connect.
Okay.
And
take
I
care.
think thank you, Melody, so much. I think Gabriel, if you haven't, we can put Ahmad's website address into the chat. If we haven't already, you probably did. That way people can also get in touch with you. Okay, I'm going to bounce back and forth between the raised hands and things in the Q&A. So someone asked, do you have any experience with chronic pain apps? Now, I know we were talking about getting off our phones, but that's really about the work thing. As far as effectiveness and how they fit in with HIPAA and high tech. So if it's for your personal chronic pain, I guess I'm wondering, are we thinking there might be issues with HIPAA? So I don't know for sure how you'd want to answer that, but just want to.
Another great question. Technology and clients is something that scares me to death sometimes just because of HIPAA. I don't want to make a mistake and send out an email and I didn't blind carbon copy or whatever. I don't have any experience on apps in chronic pain. The one thing for me personally, the one thing that I didn't want to do was look at my phone or look at technology when I was in pain, other than TV to watch movies, but I really wasn't watching because I was hurting. I do not know about any particular apps that would be helpful other than Xbox and PlayStation was helpful because it allowed me to engage and distract myself with other things. But I will look into that. That's a great question. I'm just not in the know on the apps that do that. Other than like Mindspace, I think there's Mindspace or one of my clients told me about Mindspace that they can do some like meditation kind of stuff. So that one, but I haven't used it personally, so I don't want to speak to it. But I heard about that one. That's about the only one I've heard about. I think that's an Android app, if I'm not mistaken.
Yeah, no, I appreciate everyone's putting Headspace, bunch of
Headspace, that's what it was. That's what it was. Thank you.
Putting. So okay, Laura, want to allow you to talk. So I'm gonna try and do that. We haven't done a lot of this, so hopefully you can speak now.
Laura, you there?
I think I'm asking to unmute now.
I'm gonna go ahead and stop
Can
sharing.
you hear me?
Oh, yay!
Yes.
Awesome. It says the host would like to promote you as a panelist. Should I click on that?
It's okay.
Or
You're
stay as
speaking. I think
attendee?
you can. Yeah, just I think stay as attendee. I'm not really sure. We're all learning along
Yeah.
today, so I appreciate everyone's patience. But it's really nice to hear people's live voices.
Yeah. Okay. Yeah. So thank you, Ahmad, for creating this very educational and informative training. Um, this was the first time I really got the training here, and I really appreciate it. And I would like to know what are some future topics that you'll be presenting on, or if any.
Oh, yeah.
And also how we can collaborate as a community in working with chronic pain and providing chronic pain support to our clients and to ourselves in how to deal with that. Because I think that's a topic that's talked about. I started a chronic pain group in person as a peer in 2017 when I was diagnosed with fibromyalgia, because I didn't find any chronic pain community in the community, groups in the community. So that's why I started that. And so how do we continue as providers moving forward, or as peers moving forward in this chronic pain movement, so to speak?
Excellent question. So I'm going to answer your second question first. I think it needs to start in the academia space. We need to normalize this in grad school. We need, especially in this COVID world, right? So when I started going to grad school was 2017. Yeah. It wasn't no COVID, right? We were business as usual, suck it up. You got to go to work. That expectation in our society needs to start changing. There are people that are literally working till they're dead. My dad down the hall is 72 years old, wants to go back to work. And I was like, why? He's like, that's all I know how to do. That's where my communities were at. We've been conditioned to work. And I'm not about to get all the political stuff, but I'm just saying, if it walks like a duck and it quacks like a duck, it ain't a turkey. So when I see the expectations where I feel guilt for not working, now I'm a military veteran, so some of that might come from that. I didn't miss a day of work for over a decade, right? So a lot of that, I have to transition mentally in some spaces as a veteran. But for folks that are not veterans, we still have this expectation till you work till you drop. I don't know who said that, but when I find them, it ain't gonna be cool, because that's not reality, right? And I think one thing I'll say about COVID that has taught us, we can't do all things if we're not feeling healthy, right? And so maybe that's a positive out of COVID, that we can at least acknowledge there's things that can affect us. So number one, it has to start in academia. We have to normalize it. We have to build these spaces and also standards for clinicians, doctors, surgeons, therapists, etc., when we're going through these chronic pains, well, what's our step? What's our checklist? And I just find it so interesting that I was just trying to find some research, some articles, something about this topic. Nothing. Why is that? I find that very interesting. I don't believe in coincidences, but we're not cogs, we're people. And I think COVID has kind of shown that. And these younger generations are like, look, I'm not doing that for that. We have to have our own personal efficacy. So that's where I think. So in our own spaces, our own professional spaces, we should have something like, hey, what happens if one of us gets cancer? What does that look like? How do we cover the caseloads? How do we do this? Who does that? Let's start talking about it now, or someone gets sick. Future topics. A lot of my clients are gamers, and they find community in game spaces. It used to be gaming addiction is a thing. You know, I'll be honest. But do you know how many isolated people that I work with? This is the space where they have their connections. This is the space where they have their relationships, and they're just as real as anything else, right? I would love to talk about World of Warcraft and guild management and the psychology of guild management. If you know what I'm talking about, then you know, right? These younger folks live in these electronic spaces. So we have to normalize them now.
Yeah.
We have to. We just can't sit there and say, "Oh, that's you play too many games." That's where your friends are at. That's where your community's at. That's where you're seen. That's where you feel safe. So I would love to talk about that in a space. And as a gamer that's been in guilds with a lot of different personalities for different reasons, how do we manage that? I would love to talk about that. I would love to talk about making access to mental health like drinking water. I think everyone should have a therapist nationwide. And then last but not least, we need to talk about AI. When I was in grad school, there were some researchers that came and said, "Hey, wouldn't you like to help us with our AI?" And I said, "Hell no. I'm not going to work myself out of a job." So we have to talk about the impacts of AI in our communities. You know, I didn't know I was going to start living in the Star Trek era, but I guess we're here a little bit. So we got to start talking about technology and mental health more than just gaming addiction. The line between humanity and technology is getting kind of blurry. And I don't know if we're mature enough as a species to handle it. That's just my personal opinion. So I would love to have some talks about that in the mental health space.
Yeah. Maybe like AI and mental health together. That could be a topic.
It could be. Pros and cons of that, I don't know.
Yeah.
I don't know what I don't know yet. So, but I think about it. 10 years from now, AI is already taking jobs. So what does that mean to a whole displaced community? How do we serve them? When you're talking about, you know, you can't get the job at McDonald's because you got the robot doing it. What's that going to do to your mental health? So we need to start talking about that. Hopefully that answers your questions.
Yeah.
Thank you. Oh yeah, I'm seeing just so much great stuff in the chat. We're gonna have to make like a report out of all of these ideas. Laura, thank you so much. I hope we got your questions answered, and for us, you know, I again, big shout out to Gabrielle, who brought Ahmad into our MHTTC family because they knew each other from way back when. And I'm so humbled. I'm so grateful for all, and just hearing the kinds of topics that you're thinking about and what others are sharing. And when you do your evaluation, there's a place you can write some other stuff if you want us to hear other comments, or you can email us. We're very open about doing topics that are relevant and responsive to what you all know our needs in the field. And we can't always know that without input. And so really appreciate your sharing what you think would be good topics, you know, from all the audience as well. So thank you, Ahmad. Those sound like really important topics. I only know some of the words you've talked about because of my partner who plays video games. So I can't believe that actually came in handy in my job. But yes, I've heard a little bit about that. And it's an interesting topic, you know, thinking about, we don't want to be isolated and never get out and see people. But if these are where these strong relationships are happening and they are real, right? This is not, you know, and then if there aren't enough therapists and you turn to apps or AI related tools because you need something like this conundrum that we're in of living with screens and digital spaces, but also, probably my opinion, getting out in nature, is also really good. So how do we do that and have a balance? So I know there's no answer to that real quick, but we have one more question in the Q&A. I want to make sure I get to that, but Laura, did you feel like you got what you needed from that?
Yes.
Okay, great. Thank you so much. And thanks, Ahmad, and I will say we're happy and excited to work with Ahmad. I've shared this multiple times with him. When you are healthy and well and have everything else together, because we don't want this to be a stress. But you've been very good at, letting us know when you can or can't do something. And so we're very mindful of that. So we're trying to practice what you're preaching and help you practice what you're preaching.
Please, I need all that.
Yeah, no, but really thank you for letting us know. No, now's not a good time. Okay, so Quentin has a question. Can you please discuss a bit about the impact of intersectional identities on chronic pain experiences? I think folks recognize that minoritized communities might experience chronic pain more frequently, quotes, but could you also speak to the differing experiences of chronic pain based on identity?
Quentin,
Wow.
I've been waiting to answer this one.
Ooh, sorry. That is that. Well, we might need the rest of the time for that, and that won't be
a question. That's a question.
That is a question. Thank you.
So let me give you context, Quentin, because I got this West Coast accent. So I'm from down south, right? And I grew up in the era of the 1970s and 80s where we didn't talk about what was going on any occasion outside of the internal family community. So I'm talking communities of color. We gave our problems to Jesus and we put some tussin on it, and we can't get sick because when we get sick, we don't get paid. We don't get paid. We don't eat. My father worked 40 plus years. I never saw that man take a day off a beat from sickness. Never. He would walk in there close to death because we're not allowed to do that. We're not seen like that. In giving ourselves permission not to do something, that's not an option. So communities of color were already behind the 8 ball, access to care, access to social services, access to the things we need. We might be living in red line communities. We might live in communities where we only have one clinic and getting there is a trick. Trying to get inside is a trick. Having that relationship and trusting doctors. Let's just talk. That's a whole separate conversation, right? Just the healthcare system and the relationship of communities of color in this country. My mom would rather go out in the backyard, make you some dandelion tea, put a salve on it, a tobacco chaw salve, slap it on there, and we use country medicine because we didn't trust the healthcare system. So until that relationship with the healthcare system improves with multiple diverse communities, because not all communities can access the healthcare system equally, right? So until we start changing some of those narratives, and those are systemic changes, right? They're all up here, but you're still sick. I don't know how many people I saw. My grandmother got the diabetes, lost her foot. She wouldn't go to the doctor. So until we change the relationship with multiple marginalized communities and the healthcare system, it's going to be really hard to get communities access to care. And until that relationship changes, until more folks from those communities can be in those spaces to legitimize, like, hey, this stuff actually works, y'all. Look at me, I'm here. I'm not going to lie to you. I'm going to sit here and answer your questions with the same vernacular and language that you're using and not use all this highfalutin Latin medical speak. I'm just going to talk to you very plainly. This is what we need to do. This is how we're going to do it. And I'm a part of this community, which requires me as a clinician of color or a provider of color to have that efficacy and to have those relationships and to be seen in that community. That's what it's going to require. because we all have chronic pain. But when you're already living in a place with trauma, causes chronic pain. Not being able to have access to finances, eating and drinking clean food and water, all these things are going to have repercussions to the body, right? I already said, wherever the mind goes, the body's going to follow. I personally believe sometimes when we don't deal with things and we repress them down, it does turn into cancer eventually. That's my personal belief. So how many moms and dads out there in communities of color working 3-4 jobs, they can't afford to get sick. So they ignore their chronic pain because a lot of people depend on them, like my aunt, who had a heart attack at work and died. Because she wouldn't take the time, or could take the time, to do her heart, go to the procedures and checkups for her heart, to get her water pills, to get her medications. She didn't put herself as a priority. She prioritized everyone else but her, because everyone was connected to her, right? When I talk about that battery capacity, she was the matriarch. And she was taking care of a lot of kids that weren't hers. She was a member of the church. That was the community where she found her mindfulness. And that woman died because she didn't have access to care. And I love my Aunt Lois. She was, yeah, you can't see her, but her picture's behind that Hamilton bag. She's an amazing woman. So I keep her picture up there as a reminder that I need to show up for myself. I matter. I need to be checking in. I need to be taking care of the things. I have to put things off to take care of myself, because otherwise, what's the point? So yes, Quentin, there's a problem in our country with the relationships between marginalized communities and the healthcare system. And until that changes, we're not going to be able to move forward in addressing our chronic pain for a multitude of reasons. And that's my story, and I'm sticking to it for that one, because I could talk about that all day, and I ain't trying to get mad on a Friday. So hopefully that answers your question.
Well, thank you so much, Quentin. Actually, I think your hand is raised. I'm going to try and allow you to talk if I do this correctly. And okay, I think you should be able to speak.
You there, Quentin? No, not yet.
So sorry.
It's all good.
Are you there, Quentin? Gabriel, I don't know what you did last time for Laura.
Yeah, I'm trying it now, but
Oh, thank you.
Quentin is now a panelist and has the
Okay.
ability to speak and be on video. So
Okay.
Quentin, the unmute button should just be all you need at this point, unless there's some other technical glitch.
You there, Quentin?
Could have been an accident. Sometimes people press it. Oh, wait.
Hello, good afternoon.
Hey,
Oh,
There we
hear
go.
you. There we are.
It's so great to be with you all. Thank you so much. Thank you, Ahmad, so much for answering that question so beautifully. I just wanted to add a couple of things
Yeah.
that people might not be super familiar with. So you mentioned a lot about the issues with medical mistrust in communities of color. Another thing that people don't often recognize has been so intrinsic to people's healthcare experiences is the impact of gender. So
Yes.
people who were
Yes.
socialized as female, our chronic pain is erased and told all the time that it's fake and it's in our head. And honestly, the healthcare system doesn't put as much money into things that impact people who were assigned female at birth as they do things that impact people who were assigned male at birth. So not only do we have that kind of double standard when it comes to men's problems and women's problems, but then for folks who belong to the transgender, non-binary, and gender expansive community like I do, folks who may present as male, who come in with female sounding issues, are also dismissed because our faces and our presentations and the issues that we're coming in with are constantly dismissed. Not only do we have a lack of cultural competence around gender and sexuality in the healthcare field in general, providers aren't taught anything that's relevant to the LGBT community and our healthcare, but also we're constantly dismissed as having fake problems or problems that don't actually matter.
Quentin, all facts, and you are 100% correct. Yes. Each specific community, we can sit and just kind of draw out how we have these barriers to care. And I mean, Native, Hispanic, LGBTQ plus, and you just break each one down. Yes. And it really comes down to healthcare not keeping up with the times, and also understanding that a lot of people are going to be coming in with different lived experiences and medical experiences. And so we need to have clinicians, professionals that are just in the know. And if you don't know, have the courage to ask and find out, and open up those windows. So, and reduce those barriers for those clinicians that may be, old school a little bit, to come into the space so they can wrap their heads around it and start having some lived experiences. I believe in lived experiences. I can read stuff all day, but Quentin, if I can sit down with you and break bread and we could just sit down and talk, that's where we find the connections. That's where the learning starts. And until that starts happening, I don't know. I'm going to keep playing Xbox.
We should do a webinar together on DEI and chronic pain.
Peanut butter and jelly. Hit me up.
Quentin, thank you so much. I'm so glad we're able to have this time. We don't normally have this in webinars, and I'm just going to put, and I haven't watched this film in a long time. It's apparently from 22 years ago, called Southern Comfort. And if you haven't watched it, it still sticks in my mind, about a transgender man who gets diagnosed with ovarian cancer. And so when you're speaking, Quentin, it just really strikes me. I was doing a presentation for another project around the history of mental health and mental health treatment, and just, the term hysteria and just all that stuff, so there's so much bias, and we really need to, we could literally talk all day. And I don't say this enough, but because we don't normally have enough time, but I really do welcome anybody that is interested in presenting for our center. Exactly like what you said. I haven't made like a formal blanket newsletter announcement, but I really, really would love that. So I'll put my, actually, Gabriel, can you put our email address for the center? I'm going to mess it up if I try to do it into our chat here. And so reach out to us and let us know if you have a topic or someone. This is the kind of thing that we really are committed to doing. Yeah, I would be thrilled to do more topics like this and what you're talking about. So thank you so much. Okay. Well, we still have a little bit of time. We can certainly give you back the gift of time, or we can wrap up if people don't have any further questions or comments, raised hands or anything else. But I know you've spoken to so many issues, Ahmad. I just can't even. So we should just have Ahmad on Fridays, all day. Just talk about so much. It's just been very, very powerful. And I'm really grateful to everybody here. I know some people have had to go, but it's really, really amazing to have everyone speak to. I mean, it just shows these topics are really, really important and really, really powerful. And they speak to all those issues that you've mentioned that kind of outside of a chronic pain context are still that the mindset that we have in the field. And why do we just keep doing what we're doing and don't listen to our bodies and how we're showing up and anything. So really appreciate the time, and I appreciate everybody's time here. So Thank you. Any parting words before we probably let everyone go?
For me, no, just be present. Ask yourself, are you living to work or working to live? And just show up for yourself and have grace. And that's it.
I want to make sure I didn't miss anything. Nope, that's an old one.
And may the force be with you. Yes, and that too.
Yes. So the eval, your input is super important. Really, really, please. We'd love to hear you. We also love to give Ahmad all the kudos, and really just takes a couple minutes, and I appreciate it. Oh yeah, we'll get the eval link once more. You also probably will get a reminder in Zoom. I think that's the way it's set up. There it is. So we'll keep the room open. Oh no, there's another. Yes, will the recording be sent out? I think in the...
You'll get an email
Thank
from
you.
Zoom that will link you to a page where we post all of our archived webinar recordings. And so, yes, just look for an automated email from Zoom. It usually is the day after that it goes out. If you don't see it, just drop us a line. We're happy to chat, show you the link. It does take us a little time to produce the webinar recording. So thank you for your patience in advance.
And I did want to say, all of our stuff is recorded. I threw that link in there, and then I'll put in, we will also have a podcast recording with Ahmad, very similar to what we talked about today, but we have others on the podcast page as well. So if they're interesting, it's usually all the same people we do webinars. So if you don't have much time, you just want to hear, like, should I watch the webinar? You get a little gist of the topic. So Ahmad, thank you so much. Thank you for being here right before you have surgery. Thank you for finding the time to be with us. Very, very grateful. And we'll hope to hear from you after things. Okay.
After let me heal up. But yeah,
yes.
I'm coming back. I love an opportunity just to share
yes.
these dialogues. I think great ideas.
Yeah. It's fantastic. Thank you so much. All right. Thank you, everybody. Take care. We'll leave the room open for just a couple. Bye, Ahmad.